NHA Medical Assistant Practice Test. Question 1. Which of the following medications would be given to treat vomiting? Option A, cysteine. Option B, acetaminophen. Option C, loperamide. Option D, promethazine. The correct answer is option D, promethazine. Promethazine is an antiemetic used to treat nausea and vomiting. Acetaminophen treats pain or fever, and loperamide treats diarrhea. Question 2. A patient has been diagnosed with an irregular heartbeat. Which of the following medications would be prescribed to treat this condition? Option A, antiarrhythmic. Option B, antiemetic. Option C, cathartic. Option D, antiseptic. The correct answer is option A, antiarrhythmic. Antiarrhythmic medications are used to treat abnormal heart rhythms. The other drug classes treat nausea, bowel evacuation, or infection prevention rather than arrhythmias. Question 3. Which of the following drugs would be used to treat GERD? Option A, Claritin. Option B, Nexium. Option C, Nuprin. Option D, Celebrex. The correct answer is option B, Nexium. Nexium is a proton pump inhibitor used to reduce gastric acid in GERD. Claritin treats allergies, Nuprin is ibuprofen, and Celebrex is an anti-inflammatory. Question 4. Of the following medications, which is not used to treat depression? Option A, sertraline, Zoloft. Option B, paroxetine, Paxil. Option C, citalopram, Celexa. Option D, Procardia, nifedipine. The correct answer is option D, Procardia, nifedipine. Procardia, or nifedipine, is a calcium channel blocker used for cardiovascular conditions. The other listed medications are antidepressants. Question 5. Which of the following formulas would correctly solve a dosage calculation problem? Option A, ordered dosage/dosage on hand times amount of drug equals dosage to be given. Option B, dosage on hand/ordered dosage times amount of drug equals dosage to be given. Option C, amount of drug/ordered dosage times dosage on hand equals dosage to be given. Option D, none of the above are correct. The correct answer is option A, ordered dosage/dosage on hand times amount of drug equals dosage to be given. The standard dosage formula is ordered dose divided by dose on hand, multiplied by the amount available. This determines the amount of medication to administer safely. Question 6. Which of the following agencies would be responsible for monitoring the use of controlled substances? Option A, CDC. Option B, DEA. Option C, FDA. Option D, OSHA. The correct answer is option B, DEA. The DEA regulates controlled substances and enforces laws related to their prescribing, dispensing, and handling. CDC, FDA, and OSHA have different public health, drug approval, and workplace safety roles. Question 7. A medical assistant is going to give a subcutaneous injection. Which of the following is true concerning this procedure? Option A. No more than 2 ml of medication should be injected using the subcut method. Option B. The angle of the needle should be 90 degrees. Option C. The injection can be given in the antecubital space. Option D. The needle length should be greater than 1 inch. The correct answer is option A. No more than 2 ml of medication should be injected using the subcut method. Subcutaneous injections are typically limited to small medication volumes, with 2 ml being the maximum listed here. Site, angle, and needle length vary by patient and medication. Question 8. Elizabeth Kubler-Ross is known for developing the stages of grief. Which of the following is true of these stages? Option A. All patients will go through all 5 stages of grief. Option B. Each patient will go through the stages of grief in the same order but not necessarily in the same amount of time. Option C. Each patient who goes through the grieving process will experience some or all of the stages of grief in varying amounts of time. Option D. The stages of grief are an antiquated method of psychology and are not recognized in current practice. The correct answer is option C. Each patient who goes through the grieving process will experience some or all of the stages of grief in varying amounts of time. Kubler-Ross stages are not experienced by every patient in the same order or time frame. Patients may experience some or all stages differently during grief. Question 9. The hierarchy of needs was proposed by which of the following psychology researchers? Option A, Maslow. Option B, Freud. Option C, Erikson. Option D, Skinner. The correct answer is option A, Maslow. Maslow proposed the hierarchy of needs, which organizes human needs from basic physiological needs to self-actualization. Freud, Erikson, and Skinner are associated with different psychological theories. Question 10. Which of the following scenarios accurately describes self-actualization? Option A, finding belongingness to a group. Option B, recognizing one's worth to society. Option C, feeling safe in one's environment. Option D, reaching one's full potential. The correct answer is option D, reaching one's full potential. Self-actualization means reaching one's full potential. It is the highest level in Maslow's hierarchy, above safety, belonging, and esteem needs. Question 11. According to Erikson's 8 development stages, trust and mistrust are most likely experienced. Option A, shortly after birth. Option B, in the preteen years. Option C, in middle age. Option D, in old age. The correct answer is option A, shortly after birth. Erikson's trust versus mistrust stage occurs in infancy shortly after birth. It centers on whether basic needs are consistently met by caregivers. Question 12. Classical conditioning is demonstrated in which of the following examples? Option A. A child starts crying upon mention of going to the doctor. Option B. A dog barks when seeing a stranger. Option C. A patient is startled when a medical assistant quickly opens a door without announcing his presence. Option D. A baby boy urinates every time his diaper is removed to be changed. The correct answer is option A. A child starts crying upon mention of going to the doctor. Classical conditioning occurs when a neutral stimulus becomes associated with a response. A child crying when the doctor is mentioned reflects a learned association from prior experience. Question 13. B.F. Skinner is regarded as being the primary researcher for which learning method? Option A, classical conditioning. Option B, operant conditioning. Option C, trial and error. Option D, kinesthetic learning principle. The correct answer is option B, operant conditioning. B.F. Skinner is primarily associated with operant conditioning. This learning method focuses on behavior shaped by reinforcement and punishment. Question 14. Nonverbal communication. Option A is not the most utilized form of communication. Option B uses facial expression and body language to send messages. Option C, most often used when sending messages over email or telephone. Option D is an ineffective manner of communication. The correct answer is option B, uses facial expression and body language to send messages. Nonverbal communication uses facial expression, posture, gestures, and body language. These cues often communicate feelings even when no words are spoken. Question 15. Which of the following scenarios provides an example of a medical assistant overcoming a barrier to communication? Option A. A medical assistant uses a lecture as a means of explaining how to run a finger-stick glucose test to an elderly patient. Option B. A medical assistant writes her directions to a patient that is hearing impaired. Option C. A medical assistant speaks loudly to a patient who speaks a non-English language. Option D. A medical assistant uses the terms stool and defecation while talking with a minor. The correct answer is option B. A medical assistant writes her directions to a patient that is hearing impaired. Writing directions for a hearing-impaired patient adapts communication to the patient's needs. It directly addresses the barrier instead of simply repeating or speaking louder. Question 16. Of the following choices, which should not be considered when performing payroll functions? Option A, number of exemptions. Option B, deductions. Option C, hours worked. Option D, number of patients roomed per day. The correct answer is option D, number of patients roomed per day. Payroll calculations depend on exemptions, deductions, and hours worked. The number of patients roomed per day is a productivity measure, not a payroll factor. Question 17. Which of the following tasks is not the responsibility of the office manager? Option A, maintain adequate supply of inventory. Option B, perform employee evaluations. Option C, ensure adequate staffing. Option D, determine the appropriate number of tax exemptions that should be made by an employee. The correct answer is option D, determine the appropriate number of tax exemptions that should be made by an employee. Employees determine their own tax exemptions on appropriate tax forms. An office manager manages staffing, inventory, and evaluations but should not decide personal tax withholding choices. Question 18. What is the best time of the day to hold an all-staff meeting? Option A, right after lunch. Option B, just prior to the office closing. Option C, at the beginning of the day. Option D, various times of the day. The correct answer is option C, at the beginning of the day. Beginning of day staff meetings allow the team to review issues before patient flow begins. It reduces disruption during clinic hours and helps align the staff early. Question 19. Which of the following employment forms is necessary when considering choosing tax exemptions? Option A, W-2. Option B, W-4. Option C, I-9. Option D, C-3. The correct answer is option B, W-4. The W-4 form is used by employees to indicate federal tax withholding information, including exemptions or allowances under applicable rules. A W-2 reports wages after the year ends. Question 20. When setting up the front desk, Which of the following would enhance patient privacy? Option A. Having a sliding window that can be closed when not conversing with patients. Option B. Having a privacy filter on computer monitors. Option C. Asking patients to stand at least 5 feet from the front desk until it's their turn. Option D. All of the above. The correct answer is option D, all of the above. A sliding window, privacy filter, and patient spacing all help protect confidentiality at the front desk. Combined controls reduce the chance that others can see or hear protected information.